Hi, my name is Kathy Clark. I'm an exercise physiologist and I help to provide exercise programs at Ramsay Mental Health. Today I'm going to speak to you about the power of exercise and how we can use exercise as medicine. To come and see an exercise physiologist, you do not need a referral from your GP, but if you have any health concerns, be it physical or mental, we do recommend that you get a clearance from your doctor to come and see us. The main reason clients will be referred to an exercise physiologist is when you're dealing with mental health conditions, we tend to really lose motivation for life. So quite often when a referral is made for someone to see an exercise physiologist, it's just to become a source of motivation, but also a source of guidelines, and for someone to really check in with as you start to set daily goals and create daily routines that will really help to support your health mentally and physically. When people come in for their first consultation with an exercise physiologist, they're so nervous. We know that if we take their blood pressure, it's going to be through the roof just because they really don't know what to expect. When you come in to see an exercise physiologist, they'll just go through your family history, they'll go through the medication that you're currently taking, they'll look at any past injuries that you've had, and then just normally we'll do a little bit of fitness testing. And when I say fitness testing, it just means checking blood pressure, resting heart rate, maybe looking at your weight if that's a concern for you. And then something like a 6-minute walk test, which you decide how fast you walk, and we just monitor your heart rate during that time frame. So it's really non-invasive, it's very low key, and it's just to really get a feel for where you're at and to make you feel safe in that environment so that you know you won't be thrown on a treadmill sprinting for those first sessions that you come to see us. So the philosophy of using exercise to help people with mental health conditions is we know that there is a massive release of endorphins within people if you can get them up and moving. So we start to really see the cultivation of these good hormones within their body. And through that avenue, you can really start to see people shifting and becoming empowered within themselves. So if we can get people up and moving, I've heard one researcher describe it like it's a little bit of Prozac and a little bit of Ritalin. So it elevates their mood, but it also helps to focus their mind. And nothing could be more powerful for people that are working through mental health disorders than those two things. So in relation to which conditions are most helped by exercise, my resounding answer would be all of them. That there isn't any condition that you're suffering from that wouldn't benefit from exercise. Exercise has been called a miracle pill for people that are suffering with any mental health issues, simply because we know that it changes brain waves, we know that it changes cortisol levels, we know that it amplifies the good hormones within the body. So if you can get people moving, then you can get people feeling empowered and passionate about their lives again. Exercise is one of the most researched and effective mechanisms that we have for dealing with depression. It is very important to get the right professional help from a psychologist, of course, and using medication to help you over those really difficult periods. But in the long term, if we can get people exercising in addition to using their medication and in addition to seeing their psychologists, then from a long-term perspective, we know that we have a lot more success if we can use the combination of those things rather than relying upon a passive modality. So if we can combine a passive modality with an active modality, so medication with exercise, then we know that from a research-driven standpoint, that is when people have the most success long-term with controlling their depression. As exercise physiologists, we know that relapse is a huge issue for people working through depression. The critical component to dealing with relapse is to have a structured routine, to make it such a habit that you don't even really question whether or not you will or you won't do it. It just becomes a daily habit. The other part of controlling or preventing relapse ideally is having an exercise partner or an exercise group. So using those social connections so that there is, again, someone depending on you to show up, and also just people that will be phoning you if you don't turn up for your exercise session. So relapse prevention, just creating daily routines and having those social connections and accountability to someone else. How long does it take for exercise to become a habit? The research shows that it takes between 21 and 30 days for something to become habitual. So the first 10 days are extremely painful in the sense of we're just out of our comfort zones. The second 10 are a little bit uncomfortable. And by the time you come into those last 10 days, you really are just creating such a groove in terms of your neural pathways that it no longer becomes an effort, it just becomes a habit. So we know willpower is infinite, and there's only so much willpower that you have to get you through your day. And that is also the reason why exercising first thing in the morning is so crucial. Quite often if we wait till the end of the day, there just isn't enough willpower left to get you to the gym or to put on your exercise gear. Quite often people that are taking medication to help them deal with their mental health concerns will find that they are beginning to gain weight. It's a double-edged sword from that standpoint, because not only are they dealing with their mental health concerns, but now they're also seeing from a self-esteem standpoint that their weight is going up. An exercise physiologist can really help someone cater a program that will help them control their weight, but at the same time look at the nutritional standpoint for them. We know that if we start to really look at what people are putting into their bodies, they start to feel better from the inside out, and then they tend to be more motivated to start to exercise as well. So using the combination of the two is by far the most powerful way of helping people control their weight gain that they might find with their medication.